Welcome back to What's Now. We are going to turn to your health, specifically skin safety during the winter. Winter has officially begun, and it means make sure that you take care of your skin during these long, cold winter months. I spoke with Dr. Hallmeyer. She has some great ideas for us right now.
Even though it's winter, you still need to worry about sunscreen. Sun safety habits are important all times of year, even in the winter, because exposure to the sun's ultraviolet rays increases your risk of skin cancer. Here with sun safety habits that we all need to know is oncologist Dr. Sigrun Hallmeyer. Thanks for joining us, Dr. Hallmeyer.
Oh, it's my pleasure, Christine. Thank you so much for having me.
So why is it important to practice sun safety habits year-round?
Right? And you're asking that question coming out of Park City, Utah, so you have a large audience that engages in winter sports. And so what you do is, number one, you get into the higher elevations, into the mountains, which brings you a lot closer to the sun. And secondly, you are in areas that are covered by snow. And snow, as much as it is so much fun, it is actually also sort of acting as a mirror. It reflects those dangerous UVA and UVB rays from the sun. So you're getting double the exposure. You're higher up and closer to the sun, plus you get an exposure from the ground as it is reflected from those snow-covered surfaces. So really an important issue for the winter, and especially in a winter sport area like yours.
And tell me more about what melanoma actually is and how it can be detected.
Yeah, great question. So it has a funny name, right? Melanoma. Well, it arises from the melanocytes, and those are the pigment cells within our skin. And what makes this disease so unique and ultimately so dangerous is that these cells are actually quite nifty. They can travel deep into the depth of our skin and gain access to our lymphoid channels and the blood vessels. And once they're in there, they can travel to quite distant places within our body and then set up shop in vital organs like your lung, your liver, your bone, or even your brain. And that is what people succumb of when they die from metastatic melanoma. Now, detection, as much as this disease is so difficult to treat, detection is a whole different ballgame. It's really easy. Many of our cancer screening assessments are invasive, like a colonoscopy for colon cancer, mammograms for breast cancer. All you need for skin cancer is a skin exam. And the best detective for skin cancer is you, yourself, the patient, right? Nobody is ever going to know your skin as well as you do. And so this is my appeal to your audience. Get naked once a month and take a look at your skin. Familiarize yourself with the molds and lesions that you have. And the best detection of skin cancer is change in those lesions over time. They're getting larger, they're getting darker, multiple colors are appearing, they're starting to bleed. Any of that will be a big red flag that you should bring to the attention of your doctor.
And what can we do to protect ourselves from skin cancer?
Yeah, so very much like it is true for many cancers, we do know what's causing it. And if we avoid exposure, we can reduce the risk, right? Don't smoke, significantly reduce your risk for lung cancer. Don't, expose yourself to UVA and UVB, significantly reduce your chance for skin cancer. Now, that's easier said than done because obviously we all want to be outdoors and there's tons of benefits of being outdoors and being exposed to the sun. It isn't so much the sun that's your enemy, it's the sunburn. So you don't want to develop any redness as a consequence of sun exposure. And you prevent that by using sunscreens readily available at your friendly drugstore or at your grocery store even. And it doesn't even matter so much what SPF you buy as long as you apply it frequently. We typically recommend every 2 to 3 hours because that's how quickly the stuff breaks down once you apply it to your skin. And that is especially true if you're engaging in any sport that involves water or if you're sweating a lot, because ultimately you're just washing off the product of your skin and then it loses its effectiveness.
If someone is diagnosed with melanoma in the early stages, what are their treatment options?
Yeah, so the unfortunate truth is that the mainstay for treatment for melanoma still involves surgery, and sometimes these can be very disfiguring because they have to be large volume surgeries to remove the entire lesion. And even with that, many patients face a significant risk of still dying from their disease because the disease recurs, comes back, right? Again, in those distant organs, lung, liver, bone. Now, I am here with Bristol Myers Squibb, one of the big pharmaceutical companies in this country that's really forged a path into the world of immuno-oncology or immunotherapy. And one of the drugs that I had the pleasure of being involved in early stage research phases was Opdivo, which is an immunotherapy that's approved for melanoma, not only in advanced disease, but more recently now also for patients with early stage disease who have undergone resection for their melanoma but still face that big risk of disease recurrence. And if they receive this treatment for 1 year, they can significantly reduce their risk of disease recurrence. Now, I'd be remiss talking about this treatment without needing to really point out that this is a discussion that needs to be housed with your oncologist and treating physician, because as much as these drugs are very effective for melanoma, they can have very significant side effects and potentially even life-threatening toxicities.
And where can we get more information?
Great, I appreciate that question, because in the framework of our little interview here, there's just so much that we have to leave on the table. So go to melanoma.org and learn how to examine your own skin. Know how you know what's behind your ear and the back of your neck, right? So there's a ton of information how this disease forms. There's pictures on there that you can look at and compare to your own skin. And if you want to learn a little bit more about immunotherapy, go to opdivo.com.
Will do. Well, thank you so much, Dr. Hallmeyer, for joining us today and giving us this important information about melanoma and skin cancer.
Wonderful. Thanks again for giving me this platform. And now all go out and look at your skin.